I knew about natural birth when my patients come to me and say, "Oh, doctor, this is our birth plan. We want a natural birth." Oh, okay. So it's helping the patients understand what exactly the process of labor is, because from our point of view, we know the complications that can occur. I mean, we try to understand that they want it to be as the process to be as normal, without any intervention, without us trying to get them to deliver quickly, because that is the biggest fear. I think among those ladies who want to deliver, they don't want us to start them straight away on medication to induce them, or to maybe rupture the membranes, because these are the birth preferences that they always come to tell you. They want it to be as how the uterus or how the process goes, you know, the labor goes. It might take days sometimes for them, because they might come in early stage of labor, but sometimes they might come just at the point of delivery.
Well, I think fathers have a very important role. They are there to actually support the wife. If people ask me as an obstetrician whether I delivered my baby at the time, my wife's child, the answer is no, because I preferred my colleague to do that, and I was actually there to hold my wife's hand. You know? So there's a lot to be said about the man being there to hold his partner's hand at the time. And then there's lots of important things that people may take for granted, like asking them whether they need anything, rubbing their back, holding their hand. Even though they are not delivering the baby, they can feel as though they are part of the process and actually trying and being there to help the mummy go through the process of labor itself. And then in some, we were talking about birth plans before, some birth plans, some of the wives actually have been very good to actually say that when I am in labor, just in case I'm not in the right frame of mind to be able to say what I want or what I need, then they'll say that my husband or my partner is going to be the one who can help to tell me what I need at that time, whether it's a form of extra pain relief or whether they think that I can stand the contraction pain for longer, because they actually know their wives very well there.
I would say just go with the flow, because anything can go wrong. And if we need to deliver the baby quickly, there must be a very good reason why we are telling you that it needs to be done. But otherwise, if everything is going smoothly, mom is okay, baby is also doing well by looking at the baby's heartbeat, then of course we will try as much as possible to respect your wishes and try not to interfere as much.
I think the important thing which I say to my patients is that whenever they go into labor, they should go into labor with an opportunity to have their choices respected. They should not be fearful when they do go into labor. So whatever choices they have and their opportunities to go into labor should go in sync with how they feel. So if a lady, for example, is very scared, then we have to obviously adjust our perception of how we should handle the process of labor itself. But then the main thing is to make sure that they feel as though they are in control of their labor in the right way, with the help of the doctors and the midwifery staff in the hospitals that they are in, and then to be able to allow the process of labor to actually become a fulfilling and satisfying experience for the mummies and daddies concerned.